Welcome to the recorded version of Managing Arthritis in Older Adults, part of the Family Caregiver Support webinar series brought to you by the American Society on Aging and a generous sponsorship from Homestead Senior Care. Okay, we have two presenters here with us today. Lakeland Hogan is a gerontologist and caregiver advocate for Homestead Senior Care. Lakeland works to educate professionals, families, and communities on issues older adults face. Lakeland is a doctoral candidate at the University of Nebraska, Omaha, where she is studying social gerontology. She has a Master of Arts in Social Gerontology and a Master's in Business Administration from UNO. Lakeland has professional experience in the private and public sectors of senior care services. She has worked on special projects for UNO's Department of Gerontology and the local area agency on aging. Lakeland serves as Vice President of the Board of Directors for the Dreamweaver Foundation and is active in the Alzheimer's Association's Walk to End Alzheimer's. Lakeland has a passion for helping others, especially aging adults and their families. Nick Turkis is also joining us today. Nick is the Director of Help and Support at the Arthritis Foundation. Nick has served at the Arthritis Foundation at the local, regional, and national level for more than 19 years. As the Director of Help and Support, he is responsible for overseeing the development and expansion of personalized consumer resources that empower people to live better with a higher quality of life and less pain. He manages the Arthritis Foundation's helpline, Arthritis Foundation Knowledge Base, the evaluation of third-party fitness and health resources, and expansion of the Arthritis Foundation Resource Finder. In addition, Nick also manages the Living Your Yes with RA community education programs. And with that, I'd like to turn the presentation over to Lakeland. And Nick, thanks for being here.
Thank you so much, Steve. Hello, everyone, and welcome to today's webinar. As you know, each month our goal is to provide additional insight about a topic from a family caregiver's perspective. And today we're going to be talking about arthritis, which we know affects older adults, but it can also affect younger people. So the family caregiver themselves might be impacted by arthritis. And today we're going to talk about arthritis and provide you with resources that you can share with the families you work with as they cope with the challenges that arthritis can present. And I'm very excited to be joined by Nick Turkis from the Arthritis Foundation. Homestead has partnered with the Arthritis Foundation in various ways over the years, and they are true experts on this topic. So I want to thank Nick for joining us, and you'll be hearing from him in just a little bit. Before we get things started, I did want to kick things off with a quick poll to see who we have on the line with us today. So we're going to pull up our first question, and we're going to ask you to choose the answer that best describes you. So how do you best fit into the aging professional community? So we'll get the poll up here, and so you can select a social worker, a discharge planner, nurse, dietitian. You might be joining us as a family caregiver, or perhaps we've missed one of those, or you don't fit into any of those categories, we missed your profession. You can select other, but we're just curious to know who we have on the line joining us today. It's always good to get a pulse on who's tuning into our monthly webinar series. So again, choose the poll that, the question in the poll that best describes you, and then we'll see what answers we have from everyone. And Steve, I can't see the poll on my end, so perhaps you can give us a clue as to who we all have with us.
Yes, that information will be coming up right in a second.
Perfect. Thank you. We'll see who we have on the line here in just a moment. Thanks for sticking with us and answering our poll that we have up on the screen.
Lakeland, it's over there in your Surveys tab.
My Surveys tab, okay. I see it. Okay, so it looks like we have majority, about 50% of you are social workers, have some nurses on the line, a few discharge planners, a few dietitians, some family caregivers, and then quite a few others. So we really appreciate you joining us today for this webinar, and we'll have another poll in just a little bit. So before we jump into today's objectives, I did want to be sure that everyone understands arthritis at kind of a high level. So we're going to kick things off by talking about that. Many of us are familiar with the word arthritis, but we might not fully understand what it is. So arthritis refers to more than 100 different diseases that cause pain, swelling, and limited movement in joints or other parts of the musculoskeletal system. Many forms of arthritis are chronic, meaning they can last for a lifetime. The limitations caused by arthritis can impact a person's quality of life, and as a result, it can also impact the caregiver's life. Unfortunately, there is no cure for arthritis, but there are ways people can manage the pain and symptoms, and Nick's going to tell us more about that in just a bit. Before I talk about the prevalence, I do want to make sure that we all understand arthritis is not a normal part of aging. Families should not ignore the symptoms or think there's nothing that can be done. As you can see on the screen, there are some visual indicators of arthritis, but oftentimes there are non-visual symptoms that present first. So we need to encourage families to get their loved one to their physician if they suspect arthritis could be the cause of their symptoms. So now on to the prevalence. Here in America, about 54 million adults have a doctor-diagnosed arthritis, and that's likely to be a conservative number. And it's estimated that by 2040, that number is estimated to grow to 78 million people. So it does affect a lot of people here in the United States. And we find that doctor-diagnosed arthritis is more common in women than men. Arthritis and other non-traumatic joint disorders are among the 5 most costly conditions among adults 18 and over. And in 2013, total medical costs and earning losses due to arthritis were estimated at $304 billion. So this really does cost our economy quite a bit. Clearly, it's a condition that as professionals we need to be familiar with because we're likely to come across it as it is very prevalent in the population that we work with. And it's likely an issue that our family caregivers will be dealing with. So with that as a background, I just want to touch on our objectives for today. First, we'll start by talking about the types of arthritis, the symptoms, and the warning signs of the most common types of arthritis that affect older adults. Then Nick's going to talk with us about how arthritis is diagnosed and the available treatments. We'll then review some tips on preventing arthritis, which again can be very beneficial for the family caregivers to hear. And we'll also talk about tips for making life easier to live with arthritis. And finally, we're going to close with some resources and support tips for the family caregiver. And Nick's going to talk about all the fantastic resources at the Arthritis Foundation. They have so many great resources. So I'm excited for us to start with the symptoms and warning signs. But before we do, I did want to do one more quick poll. We want to get a feel for the type of arthritis you see most often in the older adult population you work with. So as we get that question pulled up here on the slide, go ahead and kind of think through the patients you work with, the older adults you work with. What would be the most common form of arthritis that you see? Is it osteoarthritis, rheumatoid arthritis, psoriatic arthritis, lupus, or other? Just want to get a quick pulse on what people are seeing out there in the field. It looks like it's almost an even 50-50 split so far with osteoarthritis and rheumatoid arthritis. We have some more answers coming in. Overwhelmingly, osteoarthritis is what we're seeing. And that is kind of in line with the national statistics as to how many older adults have osteoarthritis, which we'll touch on in a little bit. But we just have a few more people typing in their answer to the question. We do have a couple people who see lupus, several that see psoriatic arthritis, but again, overwhelmingly osteoarthritis, and then we have some rheumatoid arthritis as well. So thank you again for participating in that question. So we're going to talk about the different types of arthritis that are most commonly seen, and it's those ones that were primarily listed in that poll we just took. When working with families, they can sometimes get confused about the types of arthritis and might not even realize that there are different types. So the way I like to explain arthritis to the families I'm working with, family caregivers, and even the older adults, is that arthritis is kind of a general term for chronic conditions that causes damage to the cartilage and the joints, that inflammation, swelling. It's kind of like if you compare it to another chronic condition, dementia. Dementia is an overarching term, an umbrella term, and below it are all the different types of dementia. So when you're talking about arthritis, you can kind of describe it the same way. So arthritis is that overarching umbrella, and then there's different types of arthritis that fall underneath of it. And some of the most common are listed here on the slide. In this webinar, we're going to focus a lot on two forms of arthritis, osteoarthritis and rheumatoid arthritis. Osteoarthritis is a degenerative type of arthritis which develops over time. And then other types of arthritis are autoimmune and inflammatory arthritis. And these types can in these types, the immune system can go awry and mistakenly attack the joints with uncontrolled inflammation. It can also potentially cause joint erosion and may damage internal organs, eyes, and other parts of the body. It is believed that a combination of genetics and environmental factors can trigger these types of arthritis. And as I just mentioned, rheumatoid arthritis is another common type of inflammatory arthritis that is found in the older adults we work with, and I'm going to talk a little bit more about that in just a moment. But psoriatic arthritis, a few of you had mentioned that you work with older adults that are affected by this type. It's another form of arthritis that can be caused in conjunction with psoriasis, which is a skin scaling disease. About 30% of people with psoriasis can develop psoriatic arthritis. And this type of arthritis causes inflammation that triggers joint pain, stiffness, and may even cause permanent damage if not treated early on and aggressively. Gout is another form of a metabolic inflammatory arthritis. It's not an autoimmune, but it develops in some people who have high levels of uric acid in the blood. The acid can form needle-like crystals in a joint and cause sudden, severe episodes of pain, tenderness, redness, warmth, swelling, and loss of appetite. The pain may last hours or weeks and can make it difficult to perform daily activities. Gout is related to the types and the amounts of food we eat in our diet and how our body processes or metabolizes them. So rich food and drink can contribute to the development of gout. But the real cause is how the body breaks down the purines into uric acid. And then lupus. It's an autoimmune disease in which the immune system overreacts, and a few of you had mentioned that a couple of the older adults you work with have lupus. It is a systemic form of arthritis, which means it can affect many parts of the body and not just limited to joints. So it can also impact kidneys, skin, lung, heart, blood vessels, and even the brain. So that's kind of a brief overview, but I did want to dive deeper into those two most common forms that you indicated in your poll and that we see in the aging field, and that's osteoarthritis and rheumatoid arthritis. So we'll start with osteoarthritis here on the next slide. Osteoarthritis is a degenerative disease characterized by the breakdown of joint cartilage. It's kind of the wear and tear arthritis. It's the most common form, affecting nearly 30 million Americans over the age of 45. In normal joints, cartilage, which is a firm, rubbery material, covers each end of our bones, and the cartilage provides a smooth, gliding surface for joint motion and acts as a cushion in between our bones. In osteoarthritis, that cartilage breaks down, which causes pain, swelling, and problems moving that joint. Osteoarthritis, or sometimes referred to as OA, develops slowly and worsens over time. It can also develop after trauma or injury, such as a sport injury, car injury, or so forth. Also, in some people, they are genetically at a higher risk of developing OA, and then others are at risk because of obesity or metabolic factors. About 40% of U.S. adults are likely to develop symptomatic OA in at least one of their hands by age 85. So that's how common it can be. And as we're working with the older portion of the population, we just need to be more aware of that. Osteoarthritis symptoms can also range from mild to severe. Hip and knee replacements are becoming common for end-stage osteoarthritis. Two of the women in my family personally have had hip replacements within the last year, so this is at the peak of my awareness. So I'm always interested in learning more about this type of arthritis. Usually the joints are affected by osteoarthritis. They ache or become painful, usually first thing in the morning or during or after the use of those joints. Osteoarthritis can occur in any joint, but most often affects the hands and also those weight-bearing joints, so our hips and knees, our spinal joints. Joints may also be stiffer after periods of inactivity. Therefore, it's important for people to remain physically active despite any initial discomfort they might feel. Exercise keeps the joints moving, which helps keep them lubricated and also builds strength in the muscles that surround those joints, which can better help support those joints. And we'll discuss this a little bit later in the webinar. So now we're going to talk a little bit more about rheumatoid arthritis. Sometimes you'll hear this referred to as RA. And this is, again, another common form of arthritis. And in the U.S., there's about 1.3 million people that have RA. As I mentioned earlier, it is an autoimmune disease in which the body's immune system mistakenly attacks the joints. It creates inflammation that can cause the tissue that lines the inside of the joints to thicken, resulting in swelling and pain in and around the joints. This is a systemic disease, meaning, again, it can affect the entire body and is characterized by the inflammation of the membranes, again, lining those joints, which causes that pain, that swelling. Some of the most common joints affected are the hands, feet, wrists, elbows, knees, and ankles. And it's often symmetrical, which means if it affects one side of the body, it's likely to affect the other side. In some more severe cases, rheumatoid arthritis can affect other areas of the body, such as the skin, eyes, lungs, mouth, and even nerves. So if a person has RA, their joints might feel warm to the touch. They might notice a decrease in their range of motion, as well as the inflammation, swelling, and pain. Because the inflammation is systemic, the person with RA is likely to feel fatigued. They're also likely to be at risk of becoming anemic. They might lose their appetite or run a low-grade fever. So again, when we're talking to family members that their loved ones are expressing any of these types of symptoms, we need to make sure that they're making a visit to their doctor. And as you can see, or you can imagine, RA can be challenging for the person with the disease, but also the family caregiver. And this is one of those chronic conditions that is really painful and can be debilitating. It really can affect the person's quality of life. If they're a family caregiver, it could affect their ability to work outside the home and so forth. So when I talked earlier about the cost of arthritis, these are the different types, these are examples of how it can cost our society so much because it can be so debilitating. There are other conditions that are related to arthritis, so I wanted to touch on those briefly because I do get asked quite a bit. First, about fibromyalgia. People ask, is that a type of arthritis? Well, while it affects about 3.7 million Americans, it's a condition that is associated with widespread amplified chronic pain, which is experienced in different parts of the bodies at different times. This, along with other symptoms, strongly impacts the quality of life for these patients. It's not a single disease, but more of a combination of symptoms that can be managed. And it's not a form of arthritis because it does not inflame or damage joints, but it's considered an arthritis-related condition as it's often a comorbid condition in people who have different forms of arthritis. So if somebody has arthritis, they're likely maybe to have fibromyalgia or vice versa. And speaking of comorbidities, it is common for people to have other conditions while living with arthritis. So as you can see, it's common for people to have heart disease in addition with arthritis, also diabetes. There's a high likelihood that there might be a comorbidity there. And in people who are obese, there is a likelihood that they might also have arthritis. And again, if you think about that, we talked about how those weight-bearing joints can be easily affected by arthritis. So if somebody is heavily overweight, it's putting a lot of stress on those joints. And depression can also be a common comorbidity. So we have to be aware of that as well. So when a person has comorbidities, family caregivers really need to help communicate with medical professionals and advocate for their older adult loved one. It's important to ensure that the treatments for the various conditions are being addressed and that the medications aren't negatively interacting with one another. And then family caregivers really have to be an advocate, especially when there are changes that occur in their loved one's condition. And we all know that many older adults see multiple healthcare providers, so that's why this is especially important. Communication is key. So we talked about the different types, and I'm going to pass it over to Nick now. He's going to talk about the diagnosis of arthritis. So Nick, I'm going to hand it over to you.
Thank you, Lakeland. I appreciate the opportunity to share. It is important to remember that arthritis refers to more than 100 different diseases that cause pain, swelling, and limited movement in the joints and other parts of the musculoskeletal system. The key to successful treatment is early diagnosis and the implementation of an appropriate treatment plan for that particular form of arthritis. One key factor people should be aware of in determining when they should seek medical treatment is swelling or stiffness in joints that last for more than 2 weeks. This is important to share with family caregivers that can keep a journal to track symptoms, and I'm going to talk a little bit more about a resource the Arthritis Foundation has to help you out with that. This can provide a more complete picture for healthcare professionals. A symptoms journal can be kept for several weeks to help track the pertinent facts about the condition and also help track changes that may occur. If the pain is consistent, then an appointment should be made with your primary care physician. When physicians diagnose arthritis, they do so on several factors: the overall pattern of symptoms, medical history, a physical exam, imaging studies such as radiographs like X-rays and MRI, and bone scans and laboratory tests. Although there is not a definitive test for rheumatoid arthritis, there is a blood test that can help with the diagnosis of RA. A doctor may also order additional tests like sedimentation rate, or sometimes called SED rate. That test is an indicator of the presence of non-specific inflammation in someone's body. SED rate is a C-reactive protein test, or a CRP. As noted above, the doctor may order X-rays or a patient's bones and joints that may also require an MRI so we can get more precise information about what's happening in the joints. Once the tests are complete, the primary care practitioner may refer the patient to a specialist. Those specialists are called rheumatologists, and they are the true experts in arthritis care. An orthopedic surgeon are professionals that can help perform surgery like joint replacement. And other specialists that may need to be part of a treatment plan may include occupational therapists that help patients reach their highest level of independence in daily activities, a physical therapist that can restore function and prevent disability. We are going to talk a little bit more about diagnosis and treatment. Many people believe that there is nothing that can be done to treat arthritis pain, and that is just not true. As I've mentioned before, pain is a common symptom, and erasing pain is a primary goal for much of the medical treatment for arthritis. The most common first line of defense are over-the-counter aspirin and other non-steroidal anti-inflammatory drugs, also known as NSAIDs. These drugs have an immediate pain relief and anti-inflammatory effects that are relatively safe. Although, like any drug, they can have side effects that can interact with the over-the-counter and prescription drugs, so their long-term use should always be discussed with a physician. But please note that caregivers should check with the client's doctor. Just because you can buy it over-the-counter does not mean it's safe, especially among older people who have comorbidities. There are some big warning signs for those NSAIDs in older adults. They especially include risk for heart attack and GI bleeding. So again, with prolonged use of any over-the-counter medications, we highly recommend that one speaks with the client's physician. And also because of the prevalence of arthritis, many prescription drugs have also been developed. So in the case of rheumatoid arthritis, there have been some significant advances in the last 20 years. Newer medications called biologics that can actually go to the source of the inflammation, that immune response has been a major breakthrough. These biologics are genetically engineered proteins derived from human genes, and they inhibit the specific components of the immune system that play a pivotal role in fueling inflammation. In addition to the use of those biologic drugs, there are also drugs like corticosteroids that can be used. These are different from the steroids that you may have heard that are often associated with weightlifters. These drugs are major anti-inflammatory medications that can be injected or can be taken as an oral pill. However, like NSAIDs, they may have side effects, so doctors like to leave patients on them don't like to leave them on those medications for very long. However, you should never stop a corticosteroid cold turkey. They need to be tapered off slowly. Another drug sometimes injected into the joints is hyaluronic acid, and it's also known as viscosupplementation. This is a way to oil or lubricate the joints, and there are some positive effects for many patients, although the treatment can only be done a few times. Other treatments include the use of heat or cold over the joints or muscles to give short-term relief from pain and stiffness. And there are some alternative therapies like acupuncture, medication, aromatherapy, herbal remedies, and supplements that may offer results in conjunction with traditional therapy. But it's important to plan these alternative therapies in consultation with your physician. There are also two surgical options. One is to inject a joint with a man-made version of joint fluid, that's that hyaluronic acid, or B is to have surgery to rebuild or replace a joint. You probably have clients that have had a total hip or knee replacement, although they can replace other joints now as well. And next we're going to have Lakeland talk about some lifestyle tips to manage arthritis.
Thank you so much, Nick. That was really important information. So yes, there are some lifestyle changes that can help with the management of arthritis and the improvement in the quality of life for people living with arthritis. And one of the best ways for all of us to protect our joints really is to lose weight if needed. Even a small reduction in our weight can help. The more someone weighs, again, the more stress is put on their hips, knees, back, and feet, which can cause issues, if not now, especially down the road. It's also important to have regular exercise. Research shows that even a limited amount of exercise can help to improve some of the negative effects of arthritis, again, by strengthening those muscles that help to support the painful or damaged joints. Strong muscles also keep the joints from rubbing against one another and wearing down that cartilage. That's so important. Also, eating a well-balanced diet can be helpful, and I'm going to talk more about that in just a bit. It's also important not to sit for too long or be static for too long. It's important to get up and moving as often as possible to prevent stiffness. And it's also important to manage pain as prescribed by the doctor and stay on top of those medication regimes. Sometimes people will, and this applies to not just arthritis, many conditions, people will start to feel better. They might think, oh, I don't need those medications anymore, and that's when the pain can creep back up. So again, want to make sure that older adults are taking those medications as prescribed. And a couple of these tips are so important that I wanted to dive into them just a little bit deeper. First is physical activity. Again, physical activity can reduce pain and improve physical health, and caregivers can engage in this physical activity, or caregivers can encourage their older adult loved ones to engage in these activities alone or engage in exercise programs. And there are some evidence-based exercise programs, and Nick's going to talk a little bit more about that later. Some types of exercise that are particularly good include range of motion or flexibility, aerobic or endurance, strengthening types of activities, walking, and water or aquatic activity. Another area where family caregivers can really encourage is healthy nutrition. So we've been talking about how eating right can be a big factor, and the key really is to eat a well-balanced diet. Some people have had success in following an anti-inflammatory diet. A popular one is the Mediterranean diet. This diet is low in processed foods and saturated fats, but high or rich in fruits, vegetables, fish, nuts, and beans. On an individual level, a person's arthritis symptoms may be impacted by what they eat. Some foods might help inflammation, while others trigger arthritis flares or increase their symptoms. So keeping a food journal can be helpful. Caregivers can help the person track what foods they eat and their levels of pain, and then they can look for some patterns. I've known some individuals who, when they eat gluten or dairy or alcohol or a combination of those three, it can cause inflammation. So again, it comes down to the person. Keeping track of what they're eating and looking for patterns in conjunction with their pain can be helpful. And then finally, reduce body weight. We've talked about that quite a bit. Even a reduction by 10% can be helpful. So we've talked about the lifestyle modifications, but how about the prevention side of things? This is especially important for those family caregivers. When it comes to arthritis, there's no known prevention measures, but there are ways to reduce the risk. So first is to maintain joint mobility and functionality, and a great way to do that is to move regularly and to exercise. The next is to avoid joint injury. I have a family member who had a water skiing injury back in her 30s that eventually led to a hip replacement in her 50s due to arthritis that developed over time as a result of that injury. So being able to avoid injury can be key. And we know that our caregivers take on a lot of physical stress and strain in their caregiving roles, so this is really important to communicate to them. There are also some modifiable risk factors for various types of arthritis. For OA, that maintaining healthy weight can be a way to reduce the risk. For rheumatoid arthritis, stop smoking or to not smoke altogether is a way to reduce the risk. And for gout, maintaining a healthy, well-balanced diet is important. We talked earlier about how diets with rich food and drink can lead to bouts of gout. So now I want to talk about some more practical tips for caregivers on how they can help their loved one manage arthritis at home. First, this might seem like a simple kind of no-brainer, but it's important for caregivers to listen and be empathetic to the older adult loved one they're working with, especially if they haven't been diagnosed with this form of arthritis and are expressing symptoms. Family caregivers need to take those concerns seriously and schedule a visit to the medical professional. Next, we need our family caregivers to be encouraging movement. Even small amounts throughout the day can really add up and make a significant difference. So perhaps it's setting a timer for every hour, encouraging them to get up and just do one lap around the house, indoors or outdoors, can make a huge difference. It might also be beneficial, as Nick mentioned earlier, to work with an occupational therapist for ideas on how to help the older adult maintain their independence and keep as much functionality as possible. And this could come at a cost to the family, but that investment could really be worth it in the long run. The family caregiver can also help to keep communication consistent among the various health providers. We've talked about that earlier, and make sure that everyone's on the same page, making sure the person's getting their medical needs met. Again, as Nick mentioned, keeping a journal of symptoms, keeping a journal of the pain, the medications, the food, can really help to track patterns and provide really valuable information to the healthcare professionals that are working with the older adult on their arthritis. You also want to remain positive and keep the focus on what the older adult can still do. Sometimes it's really easy to get discouraged by what they can no longer do, especially if there's limitations due to their joint pain, swelling, stiffness. So caregivers can help their older adult loved ones stay positive. And then finally, they can help them find creative solutions. And really, when they're coming up with those solutions, try to involve the older adult as much as possible. And I have some examples of some creative solutions here on the next couple of slides. A person living with arthritis should really do their best to keep up their activities of daily living and their routines, and this will really help to maintain their independence. And there are many products on the market today that can help people living with arthritis. First, in the kitchen and the bathroom are two of the most important areas of the home, ones that we use on a daily basis, and there are some important considerations in each of these rooms. First is grab bars. This seems, again, really simple, but they can be so beneficial in helping an older adult get in and out of the shower or the tub, or even just standing up off of the toilet. And toilet seat risers are also a nice option, can help with sitting down and rising from the toilet. And then automatic dispensers or pumps for grooming products can eliminate the need for the older adult to open a bottle or squeeze a bottle. Think of a shampoo bottle. That takes a lot of dexterity or movement of the hand to get the shampoo out, especially when it gets down towards the end of the product. So those dispensers can be especially helpful. When you think about the kitchen, foam handles for utensils can really help with grip, or encouraging the older adult to sit down while chopping or cooking, or using an adaptive cutting board. Those types of things can really help to reduce fatigue. And then crock pots are even a great way to prepare meals that don't need a lot of preparing or stirring. I have a few more additional tips here. There can be challenges for someone as they are dressing and grooming if they have arthritis. There are a lot of adaptive products available. If you Google a product such as a hairbrush and then also add the term arthritis friendly, you will get a plethora of options. Trust me, I've tried it. So you can search for specific items out there, but also button hooks can be handy, or even just replacing buttons with Velcro, or adding Velcro on to shirts that maybe have snaps can be really helpful. And sometimes people with arthritis, or not just sometimes, most likely they'll be taking some form of medication. So caregivers want to be sure that they can easily access their medication. You can ask your pharmacist for an upside-down cap on pill bottles, as you can see there on the screen. It makes it much easier to open. And usually most caps are already adjustable. You just flip it upside down. Over-the-counter meds can sometimes be in those foil packs as shown on the screen, and there are pill poppers that can help to punch out those pills from the packaging. So that is sometimes really helpful for those over-the-counter medications that don't come in the pill vial. And there's also products like Simple Meds, as shown in the screen, that box there. It puts pills into easy to open packages, and they really kind of open like a sugar packet. So all of the meds for each event time are in one little packet. So it really eliminates the need for a MediSet. So again, some just practical ways to make medication management more manageable for someone with arthritis. So we, again, need to encourage families to get creative, have them sit down with the individual living with arthritis, and have them go through their daily routine. Talk to them about what areas of their daily routine are they struggling with, and then see if there are ways to make that routine easier. We can Google some of these adaptive devices or products and help them maintain that routine, those activities of daily living, because that's important to their independence and can help maintain the limited mobility that they might still have left. So now I'm going to send it back over to Nick to talk about the resources that the Arthritis Foundation has for people living with arthritis and their caregivers. They have lots of resources, so I'm excited for him to share. So Nick, I'll pass it back to you.
Thank you so much. I work in the Help and Support Department of the Arthritis Foundation, and it is really our vision to empower people to live better and with higher quality of life with less pain. And we have many resources that are available to people with arthritis and their caregivers. And one of the first that I want to mention, I saw that we have many social workers on the call today, and I salute you. And I want to let you know that we actually have a helpline, and it's a 24-hour 1-800 number. It's actually a 1-844 number, and that's 1-844-571-HELP. And we have licensed clinical social workers that can help answer questions about arthritis, challenges working with your physician, better communicating with your physician or your healthcare provider, understanding insurance benefits and payment challenges, questions about medications and access to medication. They can, although we do not provide direct financial assistance, we do not have funds to pay for medication, we can help you find many other programs that can help people access medical care and medication, equipment, and surgeries. We have information on accessing in-home care and services, questions about Social Security, disability, legal questions, veterans benefits. They are the true experts when it comes to really navigating the healthcare maze that can be dealing with arthritis. And again, that's 1-844-571-HELP. We also have an amazing website, and I'm going to show you some resources on there at arthritis.org. And if you've never seen our consumer magazine, it is an award-winning magazine that has lots, it comes out every other month and has lots of information about arthritis, but great stories about people living with arthritis, and recipes, exercises. There's a drug guide that comes out once a year that's included. It's a great resource if you've never seen it, but check us out at arthritis.org. Several times in this presentation, we mentioned how important it is to document your symptoms with arthritis. And the Arthritis Foundation has had an opportunity to talk to lots of physicians, and when they talk to patients and they ask them how has their arthritis progressed or how have they been feeling, patients really struggle to give a meaningful answer. And so a health journal is great, but the Arthritis Foundation has a Better Living Toolkit that has a health tracker. It's a free downloadable tracker, and we encourage you to fill out that health tracker once a week. And it uses a diagnostic tool used by rheumatologists and other healthcare professionals that gives a numeric score on how well your arthritis has been doing. And you can see, are you trending up? Are you trending down? If so, why so? Is it because of increased medication? Is it loss of sleep? Is it a physical activity program that you're engaging in? But it will help you and your healthcare provider get to the bottom of why you're doing better, doing worse, and better understanding how well you're doing. It also has great tips on setting goals for improving your health and improving your communication with healthcare providers. We talked about the benefits of physical activity, and one exercise that most people can do is walking. The Arthritis Foundation has a evidence-based program that can be done individually, in that you can do Walk with Ease all by yourself with the Walk with Ease guidebook that can be purchased on arthritis.org, or you can do it in a group, and there are group Walk with Ease programs all around the country, and I'll show you how to find those classes. But we work with the National Recreation and Parks Association, the OA Action Alliance, and lots of area agencies on aging across the country to offer that program. The Arthritis Resource Finder is where you can find those Walk with Ease programs, but in addition to that, you can find lots of other group fitness programs, including water exercise, land-based exercise, aerobics classes like Zumba, yoga for arthritis, active living every day, enhanced fitness. You can find rheumatologists, orthopedic surgeons. You can find community home care resources, including in-home care. And it's all can be found at the Arthritis Resource Finder. Just Google that, or resourcefinder.arthritis.org. Search by zip code or city and state, and it's all right there. And we also have some other great resources up here. I won't read all of these to you, but some great resources for you to consider. I see we have several questions, so I wanted to go quickly through that so we could take those questions on and just check in with Lakeland and make sure we're on track.
Thank you so much, Nick. Those are some great resources that you have out there through the Arthritis Foundation. And yes, we'll leave these resources up here for you, some additional ideas for exercising, meals, medication management. Sometimes in-home care can be a nice solution for that meal preparation or helping to run errands, getting to the doctor. And then caregiver stress. There's sometimes some stress that comes along with being a caregiver for an older adult with any number of conditions. So there's some great resources on that website as well. So with that, Steve, we'll pass it over to you because I know we have some questions coming in.
Okay, great. Thanks very much, Lakeland and Nick. Great presentation. And yes, everyone, it is time for the Q&A portion of the webinar. So if you have any questions, now is the time to send them in if you have not done so already. And Nick and Lakeland, let's get to it here. The first question here for you, what alternative therapies are being used with some success?
That's a great question. Nick, does the Arthritis Foundation have any insight on that?
Well, I would say that a lot of people ask that question because they are they want to avoid traditional therapy. And I would just say that it's important first to work with a healthcare professional to find a proper diagnosis and understand what their recommendations for treatment are. Oftentimes, physicians will recommend or can offer help with some additional alternative or complementary therapies that can be done. Some would consider some exercise programs like yoga and Tai Chi as complementary therapies, and certainly physical activities are a great form of complementary therapy that we can certainly recommend. There are a number of supplements on the market. Many of them make lots of claims about health benefits. I would temper our general enthusiasm about most of these supplements in that because the supplement market is largely unregulated, and although there's a lot of unknowns regarding supplements because they aren't required to label their products as clearly as medications are. And so it's important to have a trusted brand if we are going to try any types of supplements. There is some positive hope about glucosamine and chondroitin for pain relief. None of those medications supplements can help with actually regrowing cartilage or even, so I would always kind of defer back to a physician. And it's also important to understand what type of arthritis you're talking about. A complementary therapy for osteoarthritis might be very different than considering a complementary therapy for rheumatoid arthritis or those other inflammatory forms of arthritis.
Okay, thank you. Next question here for you presenters. If a person changes their diet and therefore the symptoms are managed, is it still necessary to be on traditional therapy?
Maybe. I think if someone can find a link to their diet, certainly there are people that have reactions or allergies to different foods or different ingredients that can have an impact on their joints. But what I would recommend is that instead of just assuming that they've got it all taken care of, is to share that information with their healthcare provider and say, I've noticed when I've stopped eating dairy and my joints feel great. The physician may say, great, carry on. And the physician may say, well, let's maybe taper some of your medication or reduce medication with that information and then come back and check back in with you. But I think it's important to, really definitively track any sort of elimination diets that you're doing or any, special, additions to your diet. I would just say as long as you have the okay of your healthcare provider and you're tracking those symptoms, that should be just fine.
Okay, great. Next question, can exercise assist with hand mobility?
Absolutely, absolutely. There are some great stretching and strengthening exercises for the fingers, hands, wrists. That can be done. I do believe that we have some videos on our website at arthritis.org. But just like every, part of your body, your legs and your arms, you have muscles in your arms and hands that can definitely improve or at least reduce the negative effects of arthritis by doing strengthening, stretching, and mobility exercises with your hands. Absolutely, we tell people that motion is lotion. Keep moving is a great way to keep pain, stiffness in your joints, all of your joints down.
And Nick, I was perusing the Arthritis Foundation website, and you have a great series of videos. It's just 2-minute exercises, stretching exercises that really could be a great start to anyone's day, whether you have arthritis or not, because as you just mentioned, for all of us, our joints are important to our daily functions. So I think that even those couple minutes that people could spend on giving their joints a little love, the better off they'll be in the long run.
All right, thank you. Next question. I see some clients with hands or feet that are deformed from arthritis. Is there any way to prevent this from happening or to slow down that progress?
The good news is that in the last 20 years, there has been significant improvement in the care for people with rheumatoid arthritis, and that's typically the form of arthritis that you will see those hand and feet deformities, particularly kind of that ulnar deviation, so the kind of the east-west pointing of the fingers or the swanning of the fingers. That type of damage can largely be prevented with early aggressive treatment. Now, for those folks, unfortunately, that have where that damage exists, we cannot reverse it. But early aggressive treatment for rheumatoid arthritis, that's why whenever I hear anybody, says they have rheumatoid arthritis, the first thing I say is, do you have a rheumatologist? Right? Because if you have a rheumatologist, you have a arthritis expert that will be working with you, and they are really honing in on this early aggressive treatment to prevent that type of joint damage that can occur. We have pictures of people that, had severe deformities, in the 60s, 70s, 80s, and, at our juvenile arthritis camps and, at our support group meetings. And now newly diagnosed folks, if they can get the care, they can afford the care. These medications are expensive, but they will largely be able to prevent that type of deformity, and it's really, really exciting.
And Nick, on the Community Resource Finder, can people search for local rheumatologists in their area?
Absolutely, absolutely. They can search by city and state or zip code, and what's great too is they can find the rheumatologist, and they can that listing will also include the insurance that the provider takes. So we always recommend that you work with your insurance provider if you have an insurance provider, certainly to help with the cost. But the Arthritis Resource Finder provides a list of all of the rheumatologists in the area and their preferred networks, their contact information. So it's a great tool.
Awesome, thank you.
Right. Next question. Do the local Arthritis Foundation offices have speakers who can come out into the communities and speak about these topics to our seniors?
Many do. The Arthritis Foundation has a national footprint. We have offices in just about every major metro across the U.S., and we have local representatives, staff, and passionate volunteers, many of which can provide presentations. Again, I would go back to the Arthritis Resource Finder. There is an Arthritis Foundation offices. You can find the office that's close to you. Give them a call and let them know that you heard from Nick Turkis and you're interested in a presentation. I know most of them, so they've, again, I can't promise that everyone is available to do it. it, but many offices can accommodate a request like that.
Well, and Nick, your organization puts on a walk in a lot of communities across the nation as well. Is that right? And then people can visit the walk too to get more information.
That's right. It's the Walk to Cure Arthritis, and with your support, we will end arthritis pain. Yes, and you can definitely go to arthritis.org or our resource finder and find a local walk. It's certainly a very empowering, exciting event that helps raise funds to help fund the research to cure arthritis.
All right, great. Next question. I am not familiar with simplemeds.com. Can you talk a little bit about this and how it works?
Sure, I can speak to that. So Simple Meds is a mail order pharmacy. So they pre-package medication by event time, and they can do up to 8 events a day. It is a resource that's available to everyone of all ages. So whether you're a younger person with arthritis or other chronic conditions, if you're taking multiple medications, it's a great way to manage it. But it is free shipping and free packaging. So if you visit Simple Meds, you can call to inquire more about the pharmacy service. But the great thing about it is it opens kind of like a sugar packet. So it's very easy to open, and all the medications for each event time are in there. So instead of having to set up that MediSet or struggle to open those medication bottles for each medication event time, it's already prepackaged out for you. So definitely worth checking out, and give them a call or inquire on their site if you have more questions.
All right, great. Also, a little bit more on resources here. How can I find the Living Your Yes with RA program?
Great, good question. Go to arthritis.org/livingyourYes, and there is a list of all of the cities that will host a Living Your Yes with RA program. And if there is a registration page, the link will be green, and you can click on it and register. All of the events are free and are hosted by rheumatologists. So again, arthritis.org/Living Your Yes. And if the program is not linked green, we will be adding that program very soon.
Okay, great. Next question. I have met a few older adults who are complaining about the side effects of prescription drugs, including stomach discomfort, overflow of stomach acid. Is that normal?
It's common, but not ideal. There are some strategies that one can do to help mitigate, GI issues with their medication, but certainly, number one, bring that up to the healthcare provider. Make sure that the provider knows, and perhaps they may have medication that have a coating to prevent upset, or they may also recommend that you take an additional medication that would suppress some of the additional stomach acid, Nexium, purple pill type medication. But again, you really need a healthcare provider to take a look at the issue and make an appropriate recommendation.
Okay. Next question. Does eliminating or reducing sugar and salt help to manage arthritis symptoms?
Not particularly. We do know that foods that have a lot of sugar and salt tend to be foods that are not great for us, and that a healthy, well-balanced diet with lots of fruits and vegetables, low-fat proteins is the best diet that we know of right now. And so, although I can't say that we definitely think there's a link to arthritis with sugar and salt, we do know that adding in lots more healthy foods can help improve our weight and improve our pain and function.
Okay. Probably time for one more quick one here. My family member is on tramadol for OA, and she has been falling. Is there anything that can be done about this?
Tramadol is a medication that's kind of like a cousin of an opioid, and there may be an issue with the class of medication. There may not. That may be the best medication for her. I think the most important thing is to recommend that that person sees their physician and may even want to get a balance screening from an occupational or physical therapist. It's a whole other topic that Lakeland can do, but falls are extremely dangerous for older adults, and so we really want to make sure that you address that with the client to make sure that there isn't another issue, because it, falls in adults can be caused from a number of things: arthritis, medication, other balance issues, issues even with the home setup, lighting in the house. Lots and lots of things can be a contributor to that. So again, it's good to get the experts involved.
Yes, and there will be a fall prevention webinar later in the year, so tune in for that.
Awesome.
Good to know. Okay, well, Lakeland and Nick, unfortunately we've reached the end of our hour here, and it's time for us to wrap up. I want to thank you for joining us today for a great presentation on an important topic. Thank you.
Thank you very
My
much.
pleasure.
Have a great week, everyone.